Good morning. Hi, I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is preparing for surgery. Well, all surgeries aren't the same, but there's certain commonalities that we'd like to talk about. First of all, congratulations. You've picked a surgery, you have the date. Surgery preparation really starts about 3 months ahead of time or a little bit afterwards. Number one, you want to attain the weight that you want to be. We talk about ideal weight. For me, that's when I was in high school. Then there's realistic weight, which is probably another 15 or 20 pounds less than I am now. So we'd like to be within 15 to 20 pounds of our realistic weight. Okay, 6 weeks beforehand, you're going to make sure that you're on a high protein diet, 100 grams of protein a day. A month before surgery, you're going to stop all supplements, and if you're on birth control or female hormones, you'll also stop those. Why? Those hormones can cause blood clots, and we don't want those to happen. Okay, if you're over 45 or have medical challenges or take prescribed medications that affect your health, we'll have you see your primary care for a preoperative evaluation. This includes a CBC, measures your hemoglobin or blood levels, clotting studies to make sure you're clotting normal, an EKG to make sure your heart is okay, and depending if you're post-bariatric or a massive weight loss, we'll test for your albumin, prealbumin, transferrin. Those are all indicators of your reserves. And then lastly, if you're a smoker, we would get a chest x-ray. If it's breast surgery and you're over age 40, we'd want a mammogram at least 2 weeks before your surgery if you hadn't had one in the last 2 years. Okay, 2 weeks before surgery, you'll meet with us here in the office. We'll go over all of your pre- and post-operative orders. It's quite extensive. We'll include prescriptions, medications that you should take. Okay, 3 days before surgery, you're going to scrub your body with hexachlorophene. It's an antibacterial scrub. Then we're going to have you put in mucopurin. It's an antibiotic that we'll have you put in your nose, ears, and tummy button. Why? That's where the superbugs hang out. And we want to decontaminate your body to lower the bacterial load before surgery. Okay. During the 2 weeks before surgery, also there is no ibuprofen, Aleve, or Motrin. Why? These can all cause bleeding. Only Tylenol. Or we'll prescribe for you 2 weeks beforehand the oxycodone and Tylenol. It's known as Percocet. You could take half of such if you need to. But please look and talk with your pharmacist regarding any medications, and especially supplements. They can be quite deleterious to your wound healing if there are certain ones that you take. Okay, night before surgery. You're going to get everything lined up. You're going to have your clear liquids, Gatorade, 7-Up, or broth. You're going to have some yogurt, soft foods. You're going to lay out your clothes. You're going to bring model photos of the appearance of either your breast or body you would like to look at, and you'll make out a pre-op checklist, just like the one you received in our office 2 weeks before for us to go over. If you're having a tummy tuck or abdominoplasty, we'll request that you do a pre-op enema to clean your system out, because the medications can cause constipation. Also, have two big bags of frozen peas or corn, Costco variety, in the freezer. Why? You'll put those in a pillowcase and you'll put them on your breast or your body, and they'll conform to your body and also help with the anti-inflammation, just like athletes do. Morning of surgery, loose-fitting clothes. Bring your photos, bring your questions that you may want me to go over, because we'll be marking you all up. Also, you'll put the little patch behind your ear on the way to the surgery center. Why? This patch lets out long-acting anti-nausea medicine, often used for cruises or deep-sea fishing. Okay, You'll arrive for surgery. We'll go over all the details, and you'll be set to go home. Everything will be prepared for you. Get to the surgery center about an hour before your surgical time. So, I wish you the best as you are on the journey for your rejuvenation. Thank you, and I hope to see you soon.